Bun găsit, doamnelor, domnilor, aici la Sănătate, fără frontiere. V-am obișnuit deja săptămânal aici în studioul Observatorul Prahovean, medici de top din Turcia. Alături de mine, prin intermediul StreamYard, astăzi se află medicul Ayșe Adin Selcuk. Este medic ORL. O să discutăm despre ceea ce înseamnă intervențiile chirurgicale de rinoplastie. Hello, doctor. Nice to see you. Nice to talk to you. How are you?
Hi, nice to see you again. Fine, thanks.
As I said, Dr. Ayșe Adin Selcuk will talk today about rhinoplasty, and I would like to know, our viewers would like to know, is what techniques are used for rhinoplasty surgery?
Each rhinoplasty surgery is individual. I mean, custom fits, indeed. So some people may be bothered by a wide nostril, or the other may have a bump at the back of nose, or you may think you have a large nose, a big nose. So according to the problem that you feel about your nose, we use different techniques. But basically, we have two techniques, open and closed approach. What is the main feature between them is we have surgical incisions inside the nose in the closed technique, whereas there is a small incision under your nose here, columella, which differs the technique between them is there is a scar tissue, maybe a scar here in the open technique.
I understand, doctor. Please tell me, is there an age limit for this kind of nose job, let's say?
Yes, because rhinoplasty is an age-limited surgery based on development of the nose. Under the age of 16 or 17 in women, and under the age of 17 or 18 in men, we don't perform this surgery because the development of the nose will continue growing up to this age. There isn't any upper age limit, but in youngers, we have to wait for development of the face and both the personality development, because sometimes you may not be happy with your new nose if you have not a real personality development.
I understand. I asked you if there is an age limit, but I want to ask you if there is a maximum age for this kind of surgery.
There is an upper age.
Okay.
Mm-hmm. We can perform this operation in any age if you want. There isn't any upper age limit.
Okay.
According to me.
I understand. Is rhinoplasty a difficult intervention? Surgical intervention?
In the past, yes, it was a difficult operation for both doctors and for the patients. But thanks to very technological advances that nowadays it's very easy for both of us, for the patient and for the doctors, because in the past, there was many painful operations, some bruisings, some swellings, and it was hard for patients. But nowadays, the recovery period is easier.
Because of that technology?
Yes. For example, we used to break some bones in the past, but nowadays we use very good technological advances. For example, an instrument called piezo, so it really prevents bruisings and pain.
How long, doctor, please tell me, how long does the operation take?
It takes approximately 3 or 4 hours, and the recovery period, it will take 1 week. At first week, there will be some swellings, mild to moderate swellings, and it will pass over day by day. For example, at the end of 1 week, bruisings and swellings will pass over.
You anticipated my next question. I wanted to ask you about the post-operative process, to give us more details about this.
In fact, the most common question that I get is this: what will the recovery period feel like? I think the second day is the hardest day, I think, because of some swellings. It post-operative period, especially within weeks, all the complaints, for example, pains and swellings, will go down within days. But within months, the end shape of the skin, for example, skin tightness will release, and some scar tissues will soften. This will get months.
I understand. Please tell me, doctor, will there be an incision scar on the nose after the surgery?
In open approach, since there will be an incision here, there will be a very small incision scar within days, especially at first weeks. But in conversational distances, you are really unable to see the incision. And at the end of several months, you can't even see the incision scar.
I understand. I noted here, Dr. Selcuk, there is an opinion that the tip of the nose falls off after a month and does not stay at the same height. What do you think about this? Please tell us.
Adjusting the nose height differs according to the technique that your doctor used, but this was also a very common problem at the past. And is also a very common question that our patients ask. But nowadays we use very good techniques in order to drop the tip of nose. So helpful to these techniques that, thanks to these techniques that we don't see any droppy tips, any falling of the nose anymore.
So our nose doesn't fall after a rhinoplasty surgery.
Nowadays,
we should remain calm.
Yes.
Okay, I understand. You said the recovery period is okay, 1 week, you said. Is it a painful surgery? The first day you said that the pain is kind of hard to endure, let's say, but after that it's fine for the patient.
Our patients usually says, I have a pain at my throat because of intubation tube.
In the throat, you said?
Yeah, because they usually, very commonly, don't feel any pain at their nose. I mean, the pain of intubation tube, which means this is not a painful surgery.
I understand.
But sometimes, for example, at first day and a second day, according to the patient's condition, they may, of course, feel pain, but not a severe pain.
But the results are certainly worth it.
Sure.
I understand. Can a revision surgery be required? What should a person do in this case?
Of course, there are some rules that you have to pay attention after surgery in order to prevent these. For example, you have to obey the rules that some recommendations, for example, some in recovery period, you have to do something and you have not to do something. For example, if you get a trauma to your nose, or if you use your nose something like this, you may your nose may bend, or sometimes in cropped nose we say nose has a memory, which means within years, even after years, again your nose may bend. Sometimes very small asymmetries, very small problems may have a big problem according to the patient. And even sometimes, even a very good nose, patient may not like his or her new nose. I mean, everything goes well, but patient may not like her new nose. So sometimes revision surgery, yes, patient may need revision surgery and we perform, but we should know that revision surgery always more difficult for doctor and for patient and needs expertise.
I understand. And my last question for you, doctor, is what are the benefits of rhinoplasty surgery?
Our main goal is a breathing nose. First, a functional breathing nose.
Functional benefit, okay.
Yes, for us, I am an ENT surgeon, so a breathing nose is very important. Plus, feeling good, being better is why not? So good
aesthetic and functional, you said.
Yes, nose plus a functional nose is our main goal.
Okay, I understand. Thank you very much for all this information. Hope to talk to you again soon. Have a nice day.
Here. Thank you very much. Thank you.
A fost așadar, doamnelor, domnilor, doamna doctor Ayșe Adin Selcuk, medic orelist în cadrul Medical Park Göztepe Hospital din Istanbul. Am vorbit despre ceea ce înseamnă operația de rinoplastie, care sunt beneficiile unei astfel de intervenții chirurgicale. Ați auzit de la doamna doctor, sunt beneficii atât din punct de vedere estetic cât și funcțional. Ne referim aici la posibilitatea pe care pacientul o are de a respira mai bine în cazul persoanelor care suferă, spre exemplu, de deviație de sept. Până data viitoare, la o nouă întâlnire cu un alt medic de top din Turcia, vă doresc numai bine, toate cele bune, la revedere!